started getting very ill. Nobody knew what it was.
I started using cocaine. I used it for about 2.5 years.
We were losing a lot of neighborhood guys.
I lost my children. I lost my parents. I lost my friends. When I hit rock bottom was when my ex-husband played Russian roulette with me in front of my children.
It was the mid-1960s. The Brooklyn neighborhood of Sunset Park had lost 40,000 jobs and was overwhelmed by thousands of immigrants who were jobless, poor, and in ill health. With the future of Sunset Park in doubt, Lutheran Medical Center chose to stay committed to the community. It was obvious to George Adams, the hospital's visionary young president, that alone an inpatient facility like Lutheran could not meet the community's needs. Adams knew the future of a healthy community would also depend on family doctors and primary care. Unfortunately, the area had neither. So, with the guidance of the Sunset Park Health Council, on October 20th, 1967, the Sunset Park Family Health Center opened its doors.
Sunset Park historically has been a kind of a cradle to new immigrants, which has accommodated new waves of different immigrants, and Lutheran has adapted.
Here we have at least 5 languages that we translate everything into. So if I provide any kind of education to our patients, we do it in English, we do it in Arabic, we do it in Chinese, we do it in Russian, and we do it in Spanish. The concept behind the whole family health centers is to provide high-quality primary care to people who can't afford it.
If you have insurance, that's great. If you have public insurance, that's great. If you don't have insurance, there's a sliding scale. And if you can't afford the sliding scale, this place, like all other community health centers, is open and available to you in full.
We as providers get the opportunity to provide medical homes for our patients. It's very much like the model of having a family care doctor out in the rest of America.
You feel like you become part of their system. Like it's like, why go anywhere else? You're already there. They already know your life story. They know your medical history.
I like it. I don't know. I feel like it's home. It's nice.
This place, for many of our patients, is a part of their community. They don't see the structural walls. They see us as their neighbor.
The mission of Sunset Park is to take care of the total needs of the individual. Educational problem, economical problem, school problem, and so on and so forth. That ecological approach has made Sunset Park very unique in approaching the total well-being of the individual.
The dental department provides comprehensive care. That means that we don't do any outside referrals. So any specialty represented in dentistry, the patients can come and have that treatment here.
This community is like a Brooklyn Chinatown. So this health center is perfect for these patients who speak Chinese, and also our providers also speak Chinese.
The doctor is really nice, and also my son comes to here. He feel very happy. He never cry in there.
I did my dental residency in Lutheran in 1999 to 2000.
We're the first institution to capitalize on distance learning and distance education.
Through our video teleconferencing program, we are able to place residents in some very rural, untouched communities, such as the far-reaching portions of Alaska, where the patients have to be flown in for some of their care, out to New Mexico, to some of the Indian reservations where there's no care.
The blood work determined that I was positive, my wife was negative. I took it very hard because I didn't know much about the disease. Scared the living hell out of me.
What we've been providing is like a little place within Brooklyn, within Sunset Park, where they feel treated with love and at home.
I am a man of 68 years old now, and I have accomplished many, many things. And Lutheran helped me to survive and live and teach others how to survive and live.
I was dating this guy at the time, and we started getting into financial problems. He was laid off, I got laid off, and we couldn't afford to pay any bills or anything like that whatsoever. And a friend of his introduced him to drugs, and after that he started using, and after that I started using. Sometimes people do desperate things in desperate times.
People are accessing services that they would not ordinarily have had, because there is a stigma in terms of chemical dependency and mental health and coming to a center just for those types of services. But now those services are distributed in schools and primary care clinics, so it's like normalized services, and I think that's critical for them.
At first I was hesitant, like I don't trust nobody, but that was my addict mentality that was talking. It wasn't really me. So I started sharing. I became a human sponge. I wanted to absorb every knowledge there is so I would not make the same mistake again.
Anna is really a perfect example of what, by someone's participation in the many programs that we offer through community services, is able to really move forward and come so far in the work that they've done with us.
I started learning my math again. I started reinforcing my reading. I knew how to read, but I forgot, sort of, you know. That led me towards writing. I love writing. November 23rd, 1992. Good afternoon, Mrs. Bush and guests. My name is Anna Rivera. I want to share with you the experience of my life. I'm 30 years old, single parent with 5 children. When I finished and I looked up, everyone, and I mean everyone, including the president, was crying. And Barbara Bush came over and she goes, "You're one of the first person I've met that's really sincere, and I'm very proud to meet you." And that was the highlight, because no one ever been proud of me.
You take care of, especially the head of the household, and kind of get them into a stable mind. Of course, that's a ripple effect on the children and the families and the communities that they're in.
And then those children are going to be tomorrow's future leaders. And they're going to be the ones, the children are going to be the ones who are going to create healthy communities.
The school-based programs have RNs who are nurse practitioners. These are advanced practice nurses. We become advocates for keeping children in school, enhancing their attendance, enhancing parents' participation in their job site. We can manage chronic illnesses right there on site. The school health program has an outreach that goes beyond the actual clinic setting and beyond the children of who attend our services, particularly in the elementary schools.
There's sometimes those little girls that have low self-esteem or just don't think highly of themselves, or they just need a hug. When you can sit down and you can just talk to that child and give them 5 minutes, maybe I can change their life by letting them know that they are worth something, that they are smart, that they can do something better.
We sometimes don't know how we impact upon them until we see them as they come back. We may have known them when they were 8 and 10. And there are many students, there are some that have come back actually to work within our program as medical assistants. They have been empowered.
I always make a joke and I say that school health raised me, but they literally did. You know, they were the ones that took care of me as a child. They took care of me as a young adult, and the people in school health program have given me encouragement, and I want to further my career in the medical field, and they've inspired me. If I had a question, they were always available.
I think that these programs benefit the community as a whole, because I think that the wellness focus that family health and that the school-based health centers bring to our families go back out into the community.
I've been going to junior high schools and high school. I teach them to do other things besides being in the corner, watching other kids making that fast money, because that fast money is not going nowhere. What's good is when you work hard for your money.
I go out to the streets, and what we do is bring this HIV program to them so they'll understand what's going on and they can take it home to their children.
Lutheran took a chance on a 20-year-old single mother with no experience and gave me an opportunity to get a job. And with that, I was able to raise my son, to have the opportunities that I didn't have, not be on welfare. Everyone has the same goal. You want to raise your family, you want to live happy, and you just want to have a life. And I think that when people start talking to one another, they see that no matter where you come from, everyone has the same focus.
It's remembering some of the things that we went through when we grew up in neighborhoods. Like for me particularly, I grew up in a very similar neighborhood. It's about being able to give back.
There's no way we can give up on Brooklyn. No, there's no way.
It has achieved a lot, it's accomplished a lot, it has given us a lot, and we're still climbing up the ladder. It's not going down, it's growing.
People are they just want to work, they just want to make a better life, and they just want to really experience what the thought of America was, and it is a land of opportunity, and I think people are taking advantage of it right here in Brooklyn, and especially in Sunset Park.
The people who live here are vibrant, they're hardworking, they love their children. If that vibrancy of each community within New York is fostered and developed and nurtured, then New York as a city becomes a vibrant and sustainable entity.
When I come here, I see the sister with her sister. I see the mother with her child. So it's that human connection that you never want to lose. That real reaching out and someone reaches back.
Without their support and their belief in me, I won't be here today.